The former acting Labour leader and self-styled equalities champion has been lobbying Transport Secretary Chris Grayling to force elderly motorists to certify whether they are still fit to drive. Age UK has criticised the move, saying it could put older people off driving even when they are perfectly capable of continuing to do so. Writing in her constituency newspaper Southwark News, the London MP for Camberwell and Beckham said, "There is no upper age limit for a driving licence. But once you reach 70 you have to fill in a self-assessment form every 3 years to renew your licence. This means the responsibility is on the older person themselves to notify the driver and vehicle licensing agency of any medical impairment which may affect their driving. If there's only a gradual change you might not notice it. And some people, even where they are aware of changes, don't want to face up to them if it means giving up driving." With increasing numbers of drivers and a growing number of elderly and very elderly people, this is a road safety issue which must be addressed. There's a simple way to deal with this. Already when you are over 75 you have a named GP and are entitled to an annual health check. It would be simple and straightforward for anyone over the age of 75 to get their GP to certify whether they are still fit to drive. And without the annual recertification by the GP, who will have checked their eyesight as well, they would not be able to renew their driving license. Ms. Harman cited the 2012 case of Desreen Brooks, who was walking in Hampstead with her husband Ben Brooks Dutton and her 2-year-old son Jackson when an 82-year-old driver mounted the pavement and killed her after mistaking the accelerator for the brake pedal. Driving offences you've probably never heard of that carry huge fines and penalties to a July 18, 2017 driving offences you've probably never heard of that carry huge fines and penalties sentencing Jeffrey Lederman to 18 months in prison. Judge Peter Clark said, "An elderly driver who knows, or should acknowledge, that he or she is losing his or her faculties is no less a danger than a drunken driver who knows the same." Ms. Harman, 67, said, "For many older people driving is an important way of maintaining independence, so we mustn't prevent people from driving on the basis of their age alone. No one wants to make life harder for them, but we must keep our roads safe." She has asked Parliament's Transport Committee and Transport Secretary Chris Grayling to consider the matter. Age UK said compulsory health checks for older drivers could undermine that sense of personal accountability we all have for being safe on the roads. It added, it might also have the effect of discouraging people over 75 from driving at all when they are perfectly capable of continuing to do so. According to the DVLA, more than 1.2 million people over 80 hold a UK driving licence, and the number of people aged over 90 holding a driving licence is, for the first time, over 100,000. In 2010 Ms. Harman was fined £350 and ordered to pay costs and a victim surcharge and had her licence endorsed with 3 points after she collided with a parked car in South London. The court at Westminster heard she had 6 penalty points from speeding convictions.